and our mentors, Chief Anil Gopuanji, and also our other mentors, Dinesh ji and Shiva Subramanyam ji. I welcome all our presidents of all Samajams. Without taking their names, we will go to the subject matters. I welcome all the participants, and also I welcome all the members of ICA, IPF, IWA, and all other organizations, and all our associate members. On top of that, we have all our working committee members, including Paul Singh Saab, Chief Grover Saab, Dinkar ji from India, there's Tarun ji from India, and all others. Also, I welcome our guest speaker, Dr. Ogonian, who has helped a lot to the Indian society, Indian community during this COVID second wave and also in the first wave. He is very well known to all of us. During this Indo Eye Care Foundation Hospital, he was the main man who treated so many patients. 177 patients has been treated by him. So he is the person who has come here. Actually, SABHA would have taken this occasion to meet with all the members in a different event or something good, but unfortunately the third wave has come of the COVID, which is visually from the WHO report. For the last 7 days continuously, it is more than 150 or plus numbers are coming, the COVID positive cases in Nigeria, for which all of us have to be serious, and we wanted to create the awareness. As all of us know, before coming to the second wave in the month of November and December, all of us have not taken that seriously, and we have landed off giving up some of our friends and relatives in Lagos, especially in the Indian communities. So to avoid that type of situation this time also, before the third wave of COVID comes and catches us, we should be create awareness amongst all our community members. For that reason, SABHA has taken up so many good things, means the initiatives has taken up, which will be updated to all of us after the guest speaker speaks about what is the third wave, how we'll protect it, how COVID behavior, what are the protocol behaviors, what we have to follow, those things will be taken off by our guest speakers. I request all our presidents of Samajams and organizations who are here, if your members have not joined, please send the messages so that the people can join more and they can take the information which is the key at this moment to protect ourselves. So with this, I welcome one and all for this COVID awareness meeting to be conducted by Dr. Ogunian. So over to Pravinji for further on the meeting. Thank you.
Thank you, Rameshji, and welcome all of the participant and guest speaker. Now I would like to request Mr. Pal Singh to introduce the guest speaker in this forum. So Mr. Pal Singh ji, please. Sir, please unmute your mic.
Yes. Hello, good evening, everyone. Can you hear me, Praveen ji, now?
Yes, Mr. Pal Singh ji. Your voice is very clear now.
Okay. Good evening, everyone. I think everybody knows Dr. Tope Ogunian, but still, Dr. Tope Ogunian is a senior consultant in public health sector, and he's working in Ministry of Health in Lagos State. Dr. Gunian, he did his MBBS from University of Ibadan. He did his master's also from University of Ibadan. He also did his fellowship from University of Ibadan. Dr. Gunian is having approximately 15 years of experience in medical field, and he is a specialist in COVID treatment. Dr. Gunian was a resident doctor in Bagada Hospital during the first wave of COVID-19. And he was a resident doctor in our Indo Eye Care during the second wave. And we all know that we had a 99.9% success rate under his care when he was in Indo Eye Care. And now we all know that third wave is already alarming in Nigeria. There are some cases building up already, and we know that it is spreading fast in our community. And therefore, we need to really take care of ourselves. And we are presently in discussion with the Ministry of Health that we have our hospital ready, and whenever we get a signal, we will be able to open it within 1 or 2 days of notice. So Ministry of Health is aware of it. And as soon as they see that the cases are increasing and they are going beyond their control, they will give us a signal, and we will reactivate Indo Eye Care at same time. And we will also pray, and we'll also request Ministry of Health to keep Dr. Agunian in Indo Eye Care because most of us are very much familiar with him, and we know the service provided by Dr. Agunian, it cannot be calculated in any way. So I will not take much of the time now, and I would like to invite Dr. Agunian, and let's hear from him. Let's know what are the symptoms of new variant, and let's listen what are the precautions and what is the way forward to protect ourselves and our dear ones from COVID-19 during this third wave. Dr. Gunian, it's over to you, please. Parveenji, it's over to you.
Oh,
Yes,
sorry.
sir. So,
Okay. Good evening, everyone. Good evening, sirs. Good evening, Maz. All protocol duly observed. It's a pleasure to be able to talk and advise everyone. It's been wonderful working with Indian community during the second wave. Okay, I think I'll go straight as much as possible. And based on what Mr. Palsinga said, the third wave has is becoming serious and more serious by the day. I want to quickly give us a background of what is happening in IDH. Presently in Lagos State, the COVID patients are being managed in Lagos State in IDH. That's the Infectious Disease Hospital in Lagos presently, all COVID patients. And as of present, the hospital has had to discharge all other patients who don't have COVID, other patients that have infectious disease because of the increasing number of patients that are coming down with symptoms, coming down with severe symptoms. And the hospital is already getting filled. Not full yet, but getting filled more and more by the day. And so that shows that in line with what we are hearing worldwide, the Delta, the COVID resurgence, the third wave in Nigeria is actually true. I would like to start by saying that I would have loved to bring out a few slides. I apologize, I was told to, but in the last 2-3 days, I've been so busy. But I will do a slide after this I'll send, and I'm hopeful that it can be shared to as many people who would want to have it. But I would like to say that, as is said, the COVID, the variant which is of importance now is the Delta variant. And that has been identified in Nigeria, in Lagos, in some other states, and I believe even other states of the country are getting that variant. Now, Lagos State continues to be the major state, major center with confirmed cases suspected cases, severe cases. Lagos State continues to have the highest number. If you are following the SCDC, Lagos State continues to produce the highest number of cases of COVID. And that is actually true. If we look at what is happening in the IDH presently, we have more than at least people who are on admission presently. We can say we already have more than half of the hospital, 2/3 of the hospital already filled with COVID patients. Now, to talk about the variant, because this particular variant we're talking about now is the Delta variant. Other variants have come and are subsiding. But for this third variant in Nigeria and other countries of the world presently is the Delta variant. Now, this variant is a variant of concern according to the WHO, to the CDC, to the NCDC, and it is because of the characteristics it's bringing out. There's a lot of transmission. It spreads quickly. It spreads faster than the other variants. It's been said that where the other variants might spread to one person, it spreads from a confirmed case to one contact or one person who is exposed to the confirmed case. It is said that this Delta variant spreads faster and can infect 2-3 people, while the previous variant could have just affected one person. So there's a possibility that this variant is going to spread faster than what we have seen in the first wave and what we have seen in the second wave. It's also been said that this variant has a higher mortality and has a higher severity compared to the other variants. Now, from the IDH picture, we've not seen the type of mortality that was seen in the second wave yet, but we are actually seeing increasing number of mortalities by the day. So there's a possibility that what we have experienced, what has been experienced in other countries of the world might, hopefully we hope it shall not be, but it might want to rear its head in Nigeria, and Lagos will be a major point of focus. So we have a variant that spreads very fast, a variant that also can produce more severity and more deaths. But going beyond the variants, what are the symptoms? Other countries, it has been said that vomiting, diarrhea, abdominal symptoms are common, in addition to cough and difficulty with breathing. That's been reported in most countries. But for the symptoms we've been seeing at the IDH presently, and including even those who come in as suspected cases, and then we've had to do their test, and they come out with positive results, or we still await their results. The major symptoms that people are coming with is difficulty with breathing and cough, in addition to weakness. Cough, difficulty with breathing, and weakness. And that seems to be similar to what we've experienced in some of in the first and the second wave. So what we are seeing here is cough, difficulty with breathing, weakness, and then fever for quite some people. But these are the three major things: difficulty with breathing, cough, and weakness. But as I said, some other symptoms too have also been seen. So some people have sore throat that is persistent. Some have headache. Some have catarrh. These things have also been mentioned among the other symptoms. But and then some also have this loss of smell, loss of taste. But the major symptoms we have been seeing are cough, weakness, and then difficulty with breathing. I'll still talk about why these symptoms are important, because it will help us to guide how we'll manage or take care of patients or people we suspect around us that might have COVID. Now, we've heard about the Delta variant, which is spreading and causing COVID to increase and have more rise in Nigeria, in our state, in Lagos State. And we also talk about the symptoms. But what do we need to do, or what is the way forward? Now, the COVID cases or the COVID pandemic seems to be raising up its head again in the third wave. What we need to do is still to go back to the protective measures, to the public health measures, the safety measures that were outlined during the first wave, during the second wave. It is still relevant today. A lot of relaxation has occurred. People are not following those measures. People are disobeying protocols. People are not paying attention to those protocols. And it's occurring everywhere. But now we need to go back to those protocols. Ourselves, our loved ones, our families, in our institutions, in our workplaces, we need to start to institute those protocols again, because that is the main method of managing and controlling COVID, even for this Delta variant. So we need to ensure that we wash our hands regularly. When we touch surfaces, if we have to touch surfaces, we need to ensure that we have sanitizers and sanitizers that we have with us that we can use to sanitize our hands quickly, or running water. So our workplaces, our homes, our various institutions and establishments, we need to ensure that there's a point where people can wash their hands regularly, or sanitizers are available for them to sanitize their hands regularly. We also need to institute the wearing of the mask. That is very vital. And not the mask that just covers the chin, but the mask that covers the nose and the mouth. Because when people sneeze, when people cough, they release the COVID virus into the air, and it can spread to people that are around. And now, since this Delta variant spreads faster, that means people that cough out or sneeze out the virus are likely to spread it to more people faster than we have been seeing. So this is a time to enforce and institute wearing of the mask, covering the nose and the mouth. Also, when we in our workplaces, we need to institute that distancing. Now, we cannot close our economy. We cannot shut down the economy. We cannot shut down work, because it's going to affect individuals, going to affect the incomes of people. But we need to walk around it and see what we can do. So that means we need to ensure that, one, adequate distancing as much as possible between people. It's encouraged also about good ventilation in our various workplaces, in our various places where people gather, because there's situations like in our workplaces, people need to gather. We need to institute those spacing and ensure that there's adequate ventilation, opening windows. If we can do without using the AC, it's preferable. But for places whereby it's impossible to use the AC, adequate spacing is very important. It's also encouraged where people can we schedule our work schedule where possible, so that we don't have too many people congested in spaces. Is encouraged at this particular time. And also, despite all these, people wear their mask. Talk when they are talking, wear their mask, even in these spaces. So spacing, ventilation, wear the mask is when people are gathered together in the workplaces, in our business places. Also, it's very important at this particular time, we need to reinforce and tell our people, tell our loved ones, tell ourselves that we need to avoid gatherings that are not necessary. Avoid gatherings that are not necessary. And if gatherings have to take place, preferably let them be done in the outside, or where there's adequate ventilation. So meetings, gatherings can be done in the outside, because in the outside, the possibility of spread is much more reduced. And then people can use their mask, and it's more comfortable because they are not in an enclosed place with a mask. So if we have to gather together for whatever reason, and it's compulsory, preferably let's use the outside, and we can do adequate spacing there and also use the mask. And also, it's very important here that for our elderly ones, because I need to mention these people that have been coming to the hospital is still the same, it's still the major set of people that were affected in the first and second wave. Those who were in their 50s or late 40s and above. Those are the people who are coming down more with the disease, the severe disease, who in their 50s, 60s, 70s. And unfortunately also, the mortality has been in this particular age group, 60s and above, or late 50s and above, they are the ones that are affected the most. And also those who have chronic conditions like diabetes, hypertension, obesity, they are the ones that are coming down with the major mortalities we are seeing. So it still is necessary at this particular time for our elderly ones, for our parents, and those who have chronic conditions to ensure that they protect themselves. And we also help them to protect themselves. So they are the ones that need to ensure that gatherings, much more than us, when not necessary, are avoided. And if they must go for gatherings, they need to do it as much as possible in open spaces or with masks. This is very vital. And also to ensure that for those who have chronic conditions, they ensure that they manage their chronic conditions well. It's unfortunate, but this is also a time not to go and visiting unless necessary. Going and visiting is, unless necessary, needs to be avoided now or limited now, because the COVID virus is actually spreading. This Delta virus is spreading. And so for those who are at risk of coming down with the severe disease, at risk of coming down with more complications, need to be much more careful. Another issue here, which is actually we found, and it's unfortunate also, is that the people who are affected the most are those who are not being vaccinated. Of course, we know that Nigeria, the vaccination coverage has been poor and not adequate enough because of the number of vaccines that are available. So most patients that have come in are people who are either not vaccinated at all or did not have the complete vaccine. Now, the way forward for this is during the next phase of vaccination, I want to encourage everyone to get as many people as possible vaccinated. Those who have been vaccinated have been found, even in Lagos here, to either just have the mild disease or have no symptoms, despite being infected. But those who have not been vaccinated or did not complete their vaccine are the major people who have been admitted, who have severe disease or have been found to have lost their lives due to the COVID. So vaccination, we found, and I know that with time, the state will likely bring out a paper on that. Vaccination has helped, indeed, as has found in other countries of the world, helped to protect people. So vaccination is something that when the next phase starts, we need to get as many people as possible, especially our elderly ones and those who have chronic diseases, to get vaccinated. So that's very vital and important. That's the major thing we need to know now. And continue with the preventive protocols. Get vaccinated when the vaccine becomes available. That I'm emphasizing. Get vaccinated when the vaccine becomes available again later this year, and ensure that we do all that is within our power to protect ourselves and our loved ones. Then lastly, for people who might have symptoms of COVID, the major symptoms are still cough, difficulty with breathing, weakness. If anyone amongst ourselves or our family members or our loved ones start to display those symptoms, I want to encourage such people to quickly seek medical attention. Seek medical attention as quickly as possible so that the condition does not deteriorate. Quite a number of people presented late, and because of that, their condition became unsalvageable even when they came to the hospital. So early presentation still goes a long way in helping to prevent and control a progression to severe disease or a progression to death. So I want to encourage people that might have, or our loved ones, when they have noticed to have those symptoms of cough or difficulty with breathing, seek medical attention and appropriate guidance will be given. Of course, one might ask, is the importance, is this still relevant to continue the vitamins, the zinc? Yes, it's still very important to still continue those multivitamins. For those who also want to use ginger, turmeric, they are safe, they can be used. steam inhalation, yes, because they still play a role in helping. So it is still encouraged at this particular time. People can continue to use the vitamins, vitamin C, vitamin D, zinc, turmeric, ginger, and those other natural herbs that could help. And also steam inhalation, of course, with caution, so as not to cause burns. It's still relevant and it's still encouraged for people that want to use them. It's very vital at this time. So I just want to say that COVID, I would like to round up by saying that COVID is actually true. It's rising in Lagos State. Lagos is still the main focus, and we need to protect ourselves. And the protocols that have been outlined are still relevant today to protect and prevent spread. Wearing the mask, washing our hands, avoiding crowded spaces, keeping distances, good ventilation, outside events when they have to be held, limited number of people when we need to have these events, and also get vaccinated when the vaccine is available. And then lastly, of course, the elderly ones, our parents, those with chronic conditions, we need to ensure that we re-emphasize to them that they need to keep themselves safe from COVID, because they are still the major people at risk of coming down with the virus. Thank you. Thank you, sir.
Thank you,
sir.
Doctor.
Yes, sir.
Very informative, sir. So
Yes, sir.
now I would like to request our Indian High Commission representative and Second Secretary of Indian High Commission Lagos, Shri Ajay Sharma ji. So please address to the audience about this third pandemic and what is going on from the Indian embassy side, and how we can contact in any case of emergency and all those things. Sir, please. Ajay ji?
You have to unmute Ajay ji.
Hello.
Yes, Ajay ji.
We can hear you. You can on your video.
Okay. Okay. Hello. Hello.
Yes, sir. Yes. It is clear now.
Yeah. Yeah. Good evening. Namaskar to one and all. Respected Ramesh Biswalji, Parveenji, Dr. Tope, and President of all Samajams, members of SABHA, and other distinguished guests, on behalf of the High Commission of India, Government of India, I convey my sincere gratitude to SABHA for organizing this webinar on COVID-19 third wave related symptoms and its medical care. As we know, the COVID has created a havoc throughout the world, and it has led to a dramatic loss of human lives and presented an unprecedented challenge to the public health system. Pandemic has also highlighted the need for the health security in the most dramatic way. It has also brought out the importance of resilience and reliable supply chain, including in the health sector. Today, I would like to special thanks to Dr. Tope for giving us this lecture on the how to contain the third wave. Basically, reiterating that we have to maintain the what this is. We have to follow the all COVID-19 protocol with diligence, like washing hands and keeping the putting the mask during the public appearance and social distancing and avoid gathering. And for this, as Parvinji asked about the help by the High Commission, I will say that anybody can contact us on any time. Our emergency number is available on the website, that was 24/7. Though we are also helping through the community, but whatever the counselor help anytime we required, we are available on 24. Even my email is also available on our website, and you can contact us anytime in the emergency. And I take this opportunity to special thanks to Dr. Tope again and his team for the contribution made by his team during for the 20-bed isolation center initiated by the SABHA during the second wave of the COVID in Nigeria. Their team has gave an unparalleled service to the community during the second wave. We deeply value our contact with the Nigerian medical fraternity. Once again, I convey sincere thanks to the SABHA for organizing this very outstanding webinar and making continued efforts for the prevention of spread of COVID-19. And if you have any particular query, you can send us to email or our telephone. We are always available. Thank you very much. Stay safe and healthy. Namaskar.
Thank you, sir. So now the house is open for everyone. Just unmute your speaker and ask questions to Dr. Ogonia. If you have anything doubt or any questions you wanted to put to him, you can put directly. So, but there is a protocol of this webinar. You just unmute your mic, put your questions and mute your mic again. So the guest speaker will convey the answer to everyone in good manner. So this is the protocol. I hope everybody will follow this. So this question answer is on. If anybody want to ask any questions, they can just put their raise the hand and unmute their mic and ask the questions, please.
Yeah, good evening.
Yeah, good evening.
Wanted to know when the vaccination for the children above 12 years are expected to start?
I think, yeah. So I request Dr. Ogenia, if you have any information about it, about that, please answer these questions.
Okay, sir. The next set of vaccination should start in August. I'm not sure if I don't know if there's an age limit, but I can promise that I'll find out and get back to us before the week is over if there's going to be an age limit. But it's going to start in August according to the information we have. So we are not sure if there's going to be an age limit, but I can get that information across to the organizers before the end of the week if there's going to be an age bracket or age range for those who qualify for the vaccine.
Thank you, sir. So, Chief Grover, please.
Thank you, Pravinji. We sincerely appreciate our guest speaker, Dr. Tope Ogonian. I have one question and one observation which I want to share with our community. Let me ask the question first. The question is, recently in this third wave, which we have seen, Dr. Ogonian, have you seen any young teenager cases coming which are showing COVID positive reports, or recent trend, youngsters are being also affected in this COVID third wave or Delta variant? Have you seen such cases?
Okay, sir. So good evening, sir. We have seen teenagers or young people who are positive, but we've not admitted or we've not seen any severe case. An example is students from Unilag. They've actually, quite a number of them have come out with positive results, but the few that had symptoms were mild, so there was no cause for admission. So that's all we have seen for now. And at present, there has been no young person who is less than 20 or even in the early 20s. Most are maybe 30 and above that we have seen admitted presently. So, but they are positive and they have mild symptoms. Some cough, catarrh, fever. That's their major complaints. And they've been treated at home based using the eco-telemed. Yes.
Thank you, sir.
Chief, you have to unmute.
Now I would like to share my observation and advice on the recent trend of third wave, which is particularly due to the Delta variant. In last 2 weeks, we have seen 7 positive cases in our hospital, and we admitted 5 of them. A very, very unique thing which we observed in these new cases was that there is a sudden deterioration in your saturation level. Unlike earlier wave, we have seen sudden drop from a saturation from 90-94 to 70-75. This particular variant does not give much time, and the condition becomes acute respiratory distress syndrome very fast, where the patient needs an oxygen support or a hospitalization support in very quick, fast speed. That's a latest trend. Be observe if you have anybody patient around your family or friends, let him be under observation of the medical supervision of a specialist or a COVID infectious disease consultant. And the strong advice which I want to give is, please do not do any self-medications or self-treatment by WhatsApp. I have somebody in India who is sending me advice to take what drugs on WhatsApp. This is not a WhatsApp thing, because the doctor has to see the physically and monitor the patient clinically regularly to avoid any kind of sudden mortality rate. That's my advice. In recent trend, be careful, alert yourself. Even the vaccinated people, those who have even taken double vaccination, twice vaccination, even some of those are getting positive in this new latest trend. And it's very lethal. Very sudden deterioration happens in the saturation level drastically, and mortality rate is very high. Please do not treat yourself at home. Do not do any self medications through WhatsApp, because you need to be monitored. Your saturation level, your D-dimer, your coagulation profile needs to be monitored regularly under the doctor care in the hospital, please. Thank you, sir.
Thank you, sir.
So now I would like to request Mr. Venkat. He has raised the hand for the questions. Please unmute your mic and ask your questions to our guest speaker.
Yeah, good evening,
Venkat, please.
Thank you,
Good
Praveen.
evening, sir. Yes, sir.
Yeah, Dr. Tope, good evening. Thank you very
Good
much
evening,
for
sir.
this enlightened talk. We really got a lot of idea about it. Dr. Tope, I have 2 questions, and I would definitely seek your advice on that, because it will help us out a lot. Number 1 question, sir, is that I have observed during my working in the field, in the pharmacies, that they were sharing with me that almost 30% of the patients coming to them are asking for cough syrup. Now, my question is that how do we, because at least we know about the other 2 variants, that if you have cough, if you have catarrh, if you do not have a good smell or taste, we used to consider that it could be COVID. Now, in this Delta variant, does the same smell and taste issue can be taken? How do we differentiate between a viral, cough and cold, which normally comes during this season, and the COVID Delta variant? That is my first question, sir. So, and of course, once I get the answer for the first question, I would like to request Praveenji to give me another opportunity to ask the second question, sir.
All right, sir. Thank you, sir. Very true. This is we're in the rainy season, and so people are going to be coming down with colds, viral infections. Very true. I think the major thing here is if the cough seems so very true. The I said most people don't have that issues with difficult not being able to smell. It's not really prominent in this case. But I think if somebody is having some catarrh and cough and is stable, it is not having difficulty with breathing, and he uses cough syrup like a day or two, and it seems to be getting worse, I would advise the person to seek medical attention, as Dr. Grover said, in the hospital. What they'll do likely is to check. So we have a number of patients that have come to the hospital, who've checked their saturation level and it's fine. And we've told them to go home, monitor themselves, pay attention to their breathing, continue whatever antibiotics or drugs they may be using, and report back if they feel that it's either getting worse or they are not improving. So using a cough syrup or vitamin C, it's not bad if you have small cough, mild cough, and even a cough syrup. If you use it, it's not bad. But if you notice you've used for like a day or two and there's no improvement, get to the hospital, let them assess you, let them assess your oxygen level, which is one of the most important things to assess in COVID, because that respiratory difficulty, distress is the major cause of death. We also have the thrombotic issues, but the major issue is difficulty with breathing. So when you get to the hospital, they will assess you, they'll look at your breathing. If it's stable, they could tell you to go back home, observe yourself further. So I think that's the way to address it, so that we don't have to rush to every hospital. A day or two of accessing yourself with the common cough syrup, vitamin C might be fine. And then take the next step after observing yourself for a day or two. I think that's the way to address it, sir.
Okay, thank you, doctor. Pravinji, can I ask my second question?
Yes, sir. Go ahead.
Yeah, sir, my second question is slightly technical.
Okay,
it is based on a study which I went through probably a month back, and it was addressed. They found out that in one of the universities where they studied patients, who are asymptomatic, they found out that the viral load was as high in asymptomatic patients as much what they will find in some of the setups where patients with serious viral loads are admitted. So it gave a very different and vague picture. At the end of the conclusion, they said that if a patient is probably asymptomatic, he may have a higher viral load, but if he is asymptomatic, he should not take any treatment, because it has been observed that if somebody who is asymptomatic, he takes treatment, actually his situation worsens in comparison to a patient who is already having symptoms and getting treated. How true is this point, sir? And can you throw some more light on this?
All right, sir. Okay, so for people who are asymptomatic, the first thing to do is that there's no cure for COVID. So every treatment is actually to either build the immunity of the body or to support or manage the symptoms the patient might have. Everything we do is to manage the symptoms or to build the immunity generally. No drug for now has been found to treat COVID. So for patients who are asymptomatic, we don't give them any treatment in the real sense. In Nigeria, in Lagos, and we've had good success, we don't give them any treatment. The only treatment we give them are the same multivitamins, vitamin C, keep your immunity strong. We don't even give antibiotics, because if they're symptomatic, it doesn't have any chest infection. So all those ones, if it's not compulsory, you give them. So that's one. Now for symptomatic, we give them the other drugs to try and address the conditions they have. And I said, also they may require oxygen, which is still directed at ensuring that we increase their immunity and we treat the symptoms. And if they have any chronic conditions also, we monitor strictly and ensure that it doesn't worsen, because that can also have a back effect on the heart, on the lungs for their chronic condition. So treating asymptomatic cases, now I believe such studies might have looked at some of the antivirals. I believe such studies might have looked at those using antivirals to treat asymptomatic cases. But as I said, it's been found that not treating asymptomatic cases does not mean that they will become symptomatic. In fact, most of them remain asymptomatic and they become negative at the end of the day. So it's possible that those studies found out that maybe when they used antivirals, it's possible that they found out that maybe it led to some reactions in the body. It's possible. But as I said, in Nigeria, majorly antivirals are, for now, according to the protocol, is not included in the treatment protocol for now. Antivirals are not included. We're treating the symptoms and ensuring the immunity remains strong. So for asymptomatic cases, treatment is limited to immunity, sustenance, and improvement. But for symptomatic cases, they may require the other treatments, including steroids when necessary, oxygen, and in some other cases, some other people might even go ahead and use antivirals in some settings. So those people symptomatic, we need to treat them, because if we don't treat them, they can deteriorate, and other conditions which might be in their body too might also get aggravated. So that's the answer for them. So their study probably looked at antivirals, which I would say is not necessary in asymptomatic, and even as said, other antibiotics are not necessary in asymptomatic. What they require is to ensure that they maintain their immunity, and the body is going to maintain that asymptomatic state until they are free from the virus.
Thank you, doctor. Thank you, Pravinji.
Yes, sir.
Thank you. So I think there is no other questions for this forum. So we can go ahead to close the this webinar after the vote of thanks. So I'm requesting all of you, whoever is present here, there is a YouTube video already in working, and anybody who has not joined here and they wanted to go through of this webinar and get the good contents for the third wave of pandemic, they can go to the SABHA Sanjukta Bharatiya Association YouTube channel, and they can watch this video again and again, and they can refer to their nearest and dearest to watch this webinar at any time. So thank you, everyone.
Pravinji,
Yeah.
just a minute if you allow me.
Yes, sir.
Yeah. Good evening once again to all of us here. Just I wanted to give an SABHA updates regarding this, our readiness, SABHA's readiness to handle the third wave of the COVID. Already Paul Singh Sahab has already mentioned. SABHA has already written to the Ministry of Health if the hospital can be reopened, indoor eye care facilities, if third wave comes. So the communication has already been given to the Ministry of Health through Mr. Paul Singh Sahab. And Ministry of Health has told that they have noted our requests. If any requirement will be there within 24 hours, from our side, from SABHA side, we are ready to reopen the hospitals. So that is there. So SABHA is committed to and informing all the community members. So we are fully ready to operate that way. In addition to that, that is the one of the critical item, oxygen. Oxygen cylinders has already been booked with the BOC gases. So those things has already been booked. In addition to that, SABHA has already imported 10 concentrators, oxygen concentrators from India, which has already been arrived. That is in Nigeria now. And in case of any eventualities for the requirement of oxygen concentrators, those things we have kept as a standby. In addition to that, SABHA's commitment to have awareness amongst all the community members. We have stopped in between because the COVID has gone away, but now since it has surfaced again as third wave, we'll try to have more and more awareness very frequently, even if the members are coming less. But of course, sorry, it will help all community members, whoever is here, they can be communicate the same thing to all the members, all the Samaj members, so that they can know about this. So getting the knowledge, getting information, it is always helpful so that we can protect ourselves and we can protect our communities. So for which SABHA is always committed, and it will continue to commit to all the members and also all participants. You are most welcome once again. Thank you.
Thank you, sir. Thank you for the update of the SABHA. So now there is a time for vote of thanks to everyone, all protocol observed, and a special thanks to Tope Ogunian, Mr. Our Indian High Commission representative, Sri Ajay Sarmaji, because he has joined in this webinar within the very short notice. And this is denoting us like we are a family, and our Indian High Commission is our first house, first place. So thank you very much, Mr. Ajay Sarmaji. And I hope all the webinar is going on time to time. And as usual, we are informing to the Indian High Commission, and we will do like that. And your Indian High Commission blessing and their grace will be continued. Thanks to Dr. Tope Ogunian for his time. Thanks to all presidents, all SABHA members, participants, whoever is here, and everyone, whoever is watching on the YouTube and other social media for this webinar. So thank you very much. Thank you, everybody. And we will take care ourselves, our neighbor, our friends, and everywhere we can just follow the protocol of the COVID and be safe, sir. Thank you very much. So house is open. Anybody want to discuss, or anybody ask something to each other, they can do. Or I can close the meeting within 2 or 3 minutes. So thank you, sir.
Thank you, sir.
Thank you.
Thanks, Parinji. Thanks to all members. Good night.